much for type 1 diabetes and being ketosis? So that's a great question, actually, type 1 diabetes. So we've had a lot of questions about diabetics taking exogenous ketones and following a ketogenic diet. The interesting thing about the research surrounding type 1 diabetics is that we have found that the research has found, and there have been some great presentations at some of the keto academies on this topic, that exogenous ketones are actually more effective for type 1 diabetics than a ketogenic diet, and they struggle to get into a ketogenic diet. Can a type 1 diabetic follow a ketogenic diet or take exogenous ketones? Yes, you can. I have quite a few patients who do, and some type 1 diabetics who are fasting as well, but you have to make sure that you are controlled diabetic. The concern is always diabetic ketoacidosis. That's not possible if you have insulin in your system, and obviously as a type 1 diabetic, you're not making insulin. So if anybody is an uncontrolled diabetic, then absolutely no, that is not an option for you. But if you're controlled, you're taking your insulin regularly, a lot of people just have sort of the continuous sort of the insulin that is just sort of continuous and released into their system. So if you're controlled diabetic, you monitor your blood glucose levels and your blood ketone levels equally, so you're as diligent about monitoring as you are your blood glucose levels, and yes, that's an option. It has been shown to be quite beneficial. And for type 2 diabetics, same thing. You need to work with somebody who is knowledgeable in the ketogenic diet, and you have to make sure that you're controlled diabetic. Those are really the most important things. So work with your healthcare provider, but there is some great research.